there, and welcome to yet another training video from K-Talk. This one's called Navigating Mental Health and Chronic Conditions or Chronic Diseases. My name is Karen Burgoyne and I'm the founder and director or CEO of my own business, which I started in 2007. Let's get on with the presentation. The topics of discussion in this video are a little introduction of myself, managing chronic conditions, key contribution factors, chronic condition examples and only examples, strategies to assist your own life, and then my contact details. I was diagnosed at the age of 30 with what was known back then in the late 90s with Asperger's syndrome. Prior to that, nothing was known back in the 70s, 80s, or when even I was young, as a teenager or adult. The diagnosis gave me answers as to why I was behaving the way I did back then. Those experiences, and even the mistakes that I never wanted to face, became turning points that shaped who I am today, teaching me lessons that helped me to grow bolder, stronger, wiser, and more determined and resilient than ever before. Managing chronic health conditions or diseases involves a proactive, holistic approach that combines medical treatment with lifestyle adjustments and emotional support. Effective management focuses on self-care, building resilience, and maintaining a good quality of life despite the ongoing health challenges that you have. There are many chronic conditions that people have in their lives that they battle each day. IBS, irritable bowel syndrome, or irritable bowel disease, or even Crohn's disease, fibromyalgia or osteoporosis, asthma, lupus, diabetes, neurological conditions such as ASD, autism spectrum disorder, ADHD, attention deficit hyperactivity disorder, COPD, thyroid issues, and even other mental health conditions, just to name a few. Did you know that chronic diseases such as fibromyalgia, IBS, which is irritable bowel syndrome, underactive thyroid, hypothyroidism, and asthma frequently overlap? No? These conditions frequently overlap due to shared root factors like systematic inflammation, autonomic nervous system dysfunction, and gut-brain axis disruptions. Management requires a cohesive approach to address how these diseases interact with each other. You might need to have a chronic disease management plan with your local GP or doctor. Their shared link lies in immune system dysregulation, chronic inflammation, and central nervous system hypersensitivity. Treating these complex co-occurring conditions requires integrated, ongoing, holistic medical care for the rest of the person's life, basically. Research the vagus nerve on Google or consult your GP or medical professional to understand how it functions within the body and influences the chronic conditions you live with or have to live with every single day of your life. Key factors of contributing to these chronic diseases that you have is an unhealthy diet, eating fast food because it's convenient and you eat it or consume it on a daily basis, consumption of alcohol or street drugs, poor diet and nutrition, not drinking enough water. The highest contribution to chronic conditions are the processed foods we eat in the supermarkets, such as frozen fish, pies, chips, pizzas, takeaway foods such as hamburgers or roast chickens. But it's also the processed meats and now the ready meals that are a convenience to a lot of people to try and find something for dinner on the way home. Even though they are cooked and they're put into plastic. That plastic can interfere with the food and that can get into your stomach. But nothing is naturally cooked because of the conveniences of the ready-made meals available to us. Lack of exercise in some people, environmental factors. As I explained, eating constant takeaway food such as McDonald's, Red Rooster, KFC or fish and chips all the time. This cartoon here is of Norm, and it was the Life Be In It campaign, and he was sitting there watching telly all day, or television. Here's my story. I have 5 or 6 chronic conditions or diseases that I've got to manage each day, and I still have to live my everyday life. Nothing stops me from living my life. I have to manage mine through medications, rest, time out, as well as doing my favourite hobbies or activities. If I'm not busy, extremely busy, as I usually am, my thoughts drift to them, which then gets me so down and depressed. That's why I need to keep myself occupied or focus on something literally every single day that I'm living my life. Here are some chronic condition examples. Someone with IBS, irritable bowel syndrome, which doesn't do any damage to your intestines or your stomach or your gut. IBD, which is irritable bowel disease, causes a lot of inflammation and leads to Crohn's disease. Someone has digestive issues, bloated stomach, as well as having chronic constipation. Imagine yourself in this position, not being able to do this. Poos, or the number 2. How would you feel in yourself? You strain and struggle to go to the bathroom, therefore relying on laxatives to assist you in this area for the rest of your life. If you had the opposite, diarrhea, sometimes there's people who can't even leave the house because they need to be near a toilet all the time. And when you're out, you're constantly thinking, where is there a toilet that I need to go? And if I'm at a facility or an event, I have to stay near the bathroom and not enjoy the event because I need to be by the bathroom all the time to go to the toilet. But sometimes, once you have your conditions under control, like I do, then that makes a significant difference to your life and yourself. You know when you're finished for the day, but it's still relying on medications for the rest of your life. Having fibromyalgia does have its consequences. Sometimes I've been in bed for a couple of days. And one particular day, I had to go to the doctor. And I was in so much pain, she gave me Valium and Panadine Forte. I was only able to take those drugs for a couple of days. But it helped me to relax and ease the pain that I was under at the time. But to keep well, I undergo the constant and ongoing treatment, both chiropractic and physiotherapy sessions, to keep my body in shape and working properly for the first time every time. But a lot of the time I do a lot of walking, and a lot of walking in the sun or at a park or wherever keeps me motivated and makes me feel happier. Mental health and asthma. To ensure that I can breathe properly and that I can go about my usual activities, including recording some of these training videos, I have to use my regular medications every day. Back in the early 90s when I was diagnosed, There weren't any state-of-the-art medications on the market back then as there is today. My asthma developed from chronic cough, wheeze, ear, nose and throat problems when I was a child. However, the medications back then were Ventolin and Becotide or Beclafort, which was only a preventer drug. So I was having these two medications all the time and I couldn't breathe, and I was on a lot of nebulizers, and my asthma has flared up a lot over my lifetime. I'm now on a medication called Trimbo, which is a triple therapy medication. I hardly have any Ventolin and my life has turned around to being normal. I was on Seretide and I was on Flutoform, but they were dual action medications. I'll explain that in the next slide. Seretide came out in 1997 and that was deemed the best at the time for all asthmatics, as it was a dual combo medications for those who had more serious complications rather than those who had the mildest versions of asthma. Now this had a long-acting reliever called Serovent put in there. I was on this Seretide for 25 years and in 2019 it never worked for me anymore. I went on to Flutoform and that worked for a while and I was happy with that, and I was having one dose twice a day of the highest one. However, I still had complications. So I went back to my respiratorist, who then put me on Trimbo, and I've been on Trimbo for quite a while. I think about 2.5, 3 years now. Not sure. But I always ensure that I take my regular medications or puffers for asthma so that I don't experience any complications or flare-ups during the day or night. And I always take them with me as well. So I've got a bag full of medications that I need to take. And that includes a little spacer, which is called Bird Healthcare. Mental health and managing medications. For autistic people like me, taking medication daily is achievable. However, when there's a lot to think about, smartphone reminders can be extremely helpful for staying on track. So this is the health app of an iPhone, and I have my medications stored on this iPhone with my health record. So if I'm unconscious, someone can get the information off my phone and see what I'm allergic to and what I take every day, and then have that as a bit of a record, even if the phone's locked. I think you could do that on a Samsung phone as well, or an Android phone. Living with multiple conditions can be mentally demanding and time-consuming. Using reminders supports people with special needs or the elderly to take their medications as scheduled. Speaking from personal experience, this directly affects my physical, mental and emotional well-being. But I'm on track because I'm autistic and I can remember a lot of things, so I'm pretty lucky. I'm grateful that I'm able to remember a lot of things. When I miss my daily medication routine, my conditions quickly become unmanageable. The consistency I rely on is disrupted and the impact is immediate on my whole body, mind and spirit. Recovery takes considerable time and effort before I can return to a stable functional state, or what I consider normal again. Dawn clocks. You can buy these online to help remind you of your medications or anything else through this website. It tells you when to go to bed, what day it is, etc., etc. Positive strategies. Find meaningful and joyful things in life that takes your breath away. E.g., go for a walk in a local park, or go up to the mountains for a camp out with your family and friends, or a drive down the beach and take a walk by it. Breathe in the fresh air that you feel around you and appreciate where you are and look where you are. And take in all these surroundings that you have in the moment while you're there at that special place that you've travelled to. You need to take care of yourself and manage your conditions first. Otherwise, it becomes much harder to stay in control. Putting your own well-being first ensures that you are also able to support others effectively. Never be idle. Keep your mind as active as possible. By finding activities to enjoy and engage with others socially will benefit you in the long term. Talk to a counsellor, psychologist or psychiatrist or mental health specialist or therapist about your needs and concerns. They can provide you ways to help you overcome these challenges that are weighing you down so much. Engage with CBT, cognitive behavioural therapy, to learn how to overcome but become more resilient and responsive to your conditions if possible. Engaging in yoga, meditation sessions or mediation sessions with your local learning centre or neighbourhood house if you can do so. Breathe in and don't stress. Management is always the key with your medications. Take them regularly to keep the symptoms under control. If you focus on them all the time, they'll bring you down to a point where you won't be able to go forward from there. Keep on doing what you do and don't let them stop you from living your best life possible. Just include them in your life. Take your medications in the morning and get on with your daily activities. Do what you can to make your own goals achievable. I'm able to maintain an active life and spend time away from home, provided I have my medications with me and manage them consistently. Now, sometimes I'm a little bit late with my medications, but overall, I'm still well under control or way under control with what I do and where I can go. And sometimes I'm finished by 10 o'clock in the morning, so therefore I've got the whole day to myself and to do what I want to do. Now here's a course book that I wrote last year from scratch. During a particularly tumultuous year, I managed to get this done. This course explains the relationship between autism and mental health. It also assists the general public how autism can affect your mental health, often in ways that are deeper and more persistent than what many people realise. Here are my contact details. If you need any more information or you'd like to watch some training videos, then please head to the YouTube channel or contact us. I'd really appreciate it if you would ask me any more questions about this video. That's the end of this presentation. Thanks for watching. You know you want to hit that subscribe button. Yeah, go for it. It also helps me. Please like, comment and share these videos with others. I look forward to seeing you in the next one.